Hi, and thank you for joining us right here at Prostate Cancer Live. My name is Todd Hartley, and I'm joined by our medical director, Dr. Rich Bevan-Thomas from USMD out of Arlington, Texas. Hey, RBT, how are you?
Hey, I'm good, Todd. Good to join you here tonight.
Now, listen, we got an important subject. Tonight we're going to be talking about prostate cancer prevention, and really, what a larger topic, really, or a more important topic for all men to listen and to understand and be able to put into practice. Tonight we're going to talk about some do's and don'ts. We're going to talk about some lifestyle modifications. Right off the bat, though, the last time we met, RBT, you said that we should be aware of our vitamin D levels. What was that vitamin D? Where do we want to be? What's the sweet spot there?
Yeah, great question. So, Todd, and that's the question. So, when we look at vitamin D, again, we can go back in that old video and find out what it does. Vitamin D is a vitamin that actually turns into a hormone, right? So that's just a quick review in one sentence. So vitamin D, when you get your vitamin D levels, most of the lower level, they call it as 30. Most of us actually, looking at the field of prostate cancer, ideally we want somewhere around 50, right? 30 is the absolute bare minimum. So if we can get our patients above, somewhere in the ballpark of 50, I actually think we're doing pretty well.
All right. Now, I told you that the same day that we did that last hangout on air that I happened to be at my doctor earlier that day, and I got my vitamin D, my blood taken. So I got my vitamin D results back yesterday. You want to know where I'm at? All right. So I ended up scoring yesterday a 55 on my vitamin D level.
See, man, and we didn't even rehearse that, right? So you
No.
just that's how you roll. How much are you on? What are you taking?
I'm taking 15,000 IUs about 3 to 4 times a week.
Got it. So you're at about 50,000, do the math, 45,000, 50,000 a week, which is pretty much, what we tell people, somewhere around, in the ballpark of around 5,000. Now, it's interesting because, you're in Arizona, so if you go out in the sun, you automatically turn into a raisin, right? So you guys are like living, on Mars. In Texas, we're like living on, hell, I don't know, like the moon on a hot day. So we have a lot of humidity, but we don't have, it's not usually not as hot. So we don't get, completely killed with that. And again, we talked about using vitamin D if we can get out in the sun for about 15, 20 minutes, and we can, and that'll actually convert that vitamin D in your skin.
The only natural sunlight that I get, or the only vitamin D that I get through my skin, comes, as my wife would say, from my computer screen. So, all right, so run me through, what are the do's and don'ts in prostate cancer prevention?
Yeah, so here we are. We talk about this, and I thought, I tell this to my patients all the time, and and here's what the first thing my patients tell me is they say, okay, doc, like I have people who come in for prostate cancer screenings. They have been diagnosed with prostate cancer. Hopefully, it never happens. And they say, all right, well, we come in, we do a PSA, and we do a physical exam, and that's all normal. And they go, well, now what? And so they tell me, well, what supplement do I need to take? And the first thing I tell them is, let's just slow down. I look at the supplements sort of like I look at supplements, whether you're a bodybuilder, whether you're a triathlete, they're the top 5 to 10% of really your entire program, right? So before we even talk about any of those supplements that may or may not help, we really start talking about a diet perspective, right? And I think there's a couple of supplements. Again, vitamin D, I'm a huge advocate of vitamin D. Again, your levels are great. I haven't tested mine in a while. Hopefully they're pretty good. I think they are. So we're going to test those. Yeah, exactly. You are getting your quote light, from your blue light from this, mind you, which actually does affect your melatonin levels. Different subject. Bottom line, though, is when somebody says, hey, how do I prevent prostate cancer? The first thing that we do is we start analyzing what are they doing for diet-wise. And why is that important? Because the number one word, and we've mentioned this before on these podcasts and the video casts that we do, is looking at inflammation. We want to control inflammation, right? So you remember that inflammation stuff we were talking about?
I sure do.
Good. So that's it. And inflammation is not like, hey, I stubbed my toe and it gets inflamed. Inflammation is primarily an immune reaction. You can have systemic inflammation. So what we're trying to do is we're trying to decrease that systemic inflammation. So if you think you can go take like a lycopene pill and go to In-N-Out Burger and you've done yourself a lot of good, hey, a little check, back to planet Earth, it's not helping you, right? So, and that's the problem is, as Americans, we want the easy way out, right? We want to go to a movie, we want to have some beers and pizza, eat a lycopene pill, and figure it's all good. So let's talk about the do's first, okay? So actually, we'll go do's and don'ts just to mix it up because, that's how we are here. We just do a little the yin and the yang, right? That's right. Number one is do, right? Do is from a lifestyle and diet exercise. So, we've talked about this before. I think we probably should have our own, prostate cancer live, session on this. But really do-wise is really watch your diet. And, people have said this, time and time again. But, at the end of the day, I tell people carbohydrates, and in particular processed carbohydrates, are the enemy. Sugar is the enemy, right? So now you can have this, one day a week, your body can process this stuff, but get rid of the sugar, right? And there's debates of whether it's the Mediterranean diet. I'm a big paleo fan because I actually don't think the problem is necessarily the meat part of this, although I would turn into a complete carnivore and eat, beef jerky 5 times a day. But what we do want to do is we don't want to combine, right, those bad meats actually with, or the meats itself, with bad carbohydrates, right? So again, Mediterranean diet, I actually try to look at it as more of like a whole foods diet. So we want to get rid of the preservatives, because every time you're taking in a preservative, anytime that you're actually eating something like a Twinkie or something like that, which again is, Twinkie's got a bad rap, they went out of business, but now they're back, right? So what we want to do is we want to minimize that. So if you can minimize that, that's what you do want to do, right? Got it. Okay, so that's pretty easy. We're going to talk about that probably in another podcast about different diets and how they can help out, right? So that's pretty good, right? Don't eat badly, right? So that's the don't. So the don't is eat badly, and the reason why is because when you eat something, so let's say for an example, you eat a Twinkie versus you're going to have, for instance, grilled chicken and some broccoli next to it. So what happens in your body, sort of in a quick mix-up, is the fact of your body then processes that, and there is an entire immune or an entire reaction that actually goes on actually in your stomach lining, and it will actually send out insulin and a bunch of other actually hormones that actually help us actually digest that food. But if some of that stuff is foreign, like a lot of these preservatives, guess what happens? We actually get an inflammatory reaction that actually occurs in the gut, right? But it's not just in the gut. So you eat a Twinkie and you go, man, I don't feel so good. Well, yeah, it's because you just ate a Twinkie, right? But there's other things happening to your body at that time, and that's the big issue. So again, do eat well, and again, what I tell people is I tell them, I keep it easy. I say, here's what you get. You get proteins, pretty much all the proteins you want. I tell them to eat, grass-fed beef and hopefully organic chicken if you can. We'll get into that later. But good proteins, right? Veggies, you knock yourself out. Veggies all day long, right? You can have a veggie-a-thon, right? So you get 2 handfuls of nuts, right? I know what you're thinking, right? But just
I think veggie-a-thon is a pretty funny word.
So you get two. So you get two. You basically two scoopfuls or handfuls of nuts, right? And then you also get 2 servings of fruit. And I think grapefruit's great. I like oranges. I like citrus. I think they're good. But you only get 2, so you can't go knock yourself out and go on the all grapefruit diet or all cabbage diet, because that's just not healthy, right? If you can do that 6 days a week, and then 1 day a week you can go out with your buddies, eat pizza and beer, and just have Skittles for dessert or something like that. Your body can actually process that, and there's some data that actually says it's not such a bad thing to do that. So that's the do's, right? That's the don'ts, and don'ts do that stuff. As part of that, and I think this is important because I got this on my list here, is what kind of meat can you eat, right? Is meat all bad? So to kind of put this in a real quick sentence here, is the fact that not all meat is bad. What we have to worry about, and there is actually some very good data out on this, is that, again, let's go back to that inflammation, right? So one of the reasons why people are pushing grass-fed beef right now is because if, cows are eating, corn and they're eating grain, what happens is normally their stomachs actually aren't used to actually this kind of food. It's like us eating a Twinkie, right? Okay, for all intents and purposes. And then what happens is that causes an inflammatory reaction within that cow's gut, and guess what? It gets stored in their body. So, cows get fat, and they get fat. If they get fat, good fat, that's not such a bad thing. But if they get bad fat, meaning that if they get an inflammatory reaction and you go and cook up that food, guess what happens? The old adage, you are what you eat. Well, that's exactly what happens. So if you're going to eat meat, it's a better idea to actually make sure that we're going, if you can do grass-fed or more organic beef, so that you don't get that inflammatory reaction.
Okay, so that's really interesting. It brings me back to when I was waiting tables in college, and I was working at a big steakhouse. We all know the steakhouse's name if I mentioned it. And you walk up to the table and you say, "Welcome to fill in the blank, where we serve USDA prime Midwest grain-fed beef." And
Right.
then, but that's grain-fed. That's not
Right.
even the animal on its natural diet.
That's
And
right.
how that transfers over into issues that manifest in our own systems, really fascinating.
It is absolutely fascinating. We're finding more and more out about this now because people are asking questions. And I hate to say it, but most of the time it's not us as doctors. It's actually a lot of guys that are smart guys that are, whether they're going to be, athletes or whether they're looking at better performance. And those guys have actually asked the right questions about this, and it's making us as physicians get better and better educated. And I've certainly looked at that data, and it's very interesting. So that's part of it, right? So if you're going to go over to, fill in the blank place, and they say grain fed, what you want to do ideally is you want to have the leanest steak that you can get, because it's the fat which actually stores a lot of those inflammatory proteins. Ideally,
so that lean steak's got to be like a fillet.
That's exactly right. And so it's better that you do a fillet there. Now, if you get a, like a bison, or if you get a, a grass-fed, organic, beef, you actually don't have to worry about that, because again, a lot of those inflammatory, cytokines and things are actually not stored in the fat as much. And so that can actually decrease it. And here's the truth. If you go out to, fill in the blank, and you go out and give like a T-bone, it's not like you're going to get cancer the next day. But the point is that every day that you do stuff like this, it's just, it's just like, it's like you're in a 15-round fight, and that guy, boom, he just gave you a jab. Well, you can only take so much of those jabs before all of a sudden, man, you start getting a black eye, and you start to get dizzy, and next thing you know, boom, you get that, you get the all of a sudden that uppercut that comes up and gets you, and boom, and you're down for the count. So we just want to minimize that the best that we can. You do it occasionally, your body can handle it, but just kind of realize that. Now, as part of this, let me follow up with this. As part of this, I want you to think about grilling. We actually wrote a blog on this at USMD Prostate Cancer Center. We wrote a blog on the fact of grilling, and the problem is that when you take meat, right, and you put it on.
Oh, well, it looks like we just lost Doc RBT. This is what happens when you're doing these remote interviews. It's bound to happen sooner or later, and it looks like it just happened right now. Well, we're talking about prostate cancer. We're talking about prevention today. Quite honestly, without RBT, I'm worthless. I'm just here to, interact and engage with him. So sit tight. Maybe RBT will be right back, and in the meantime, I'm going to buy a little time and talk to you about what we're doing at Prostate Cancer Live. Listen, we have a huge library of prostate cancer videos that feature the leading experts in prostate cancer, talking about their treatment and diagnosis, talking about symptoms. We're also talking about really interesting and innovative personalized treatment paths that could include active surveillance, or even an Oncotype DX test to determine if active surveillance is the right path for you. You'll also notice that we do these hangouts. These hangouts come to you every 2 weeks, and we do them live. Very rarely, I think this is the first time we've ever had our medical director drop out, and as we were getting connected,
Right.
He said to me, I was just telling everybody that as we were getting connected tonight, you were telling me about your cable provider and how you're ready to kick them to the curb.
I was, man. I was ready to just hit them, because they're just killing me, man. They tell me I got like the best box of the boxes, and they tell me I got 50 kabillion gigabytes per second, and it's all a load of garbage, right? So,
right.
So
well, speaking of which, you should know that when you dropped off, I confided in the audience that I'm just, without you, I'm worthless on this thing.
So you just got to go.
So I know what to do.
I'm not them Cowboys.
I know what to do. In all my radio years, I know how to buy time. And so I told the perfectly good story. I walked them through the path of what we do here at Prostate Cancer Live, and then boom, you were there. So where were you?
That's how good you are. So I'm back, and I went to go get a glass of wine, took a leak, but I'm good now, right? So that was just my blaming on Verizon moment. Okay, so we were talking about grilling, right? So I think that's where we kind of started getting left off.
Right.
So when you grill the meat, what happens is you heat that meat up so high that you denature those proteins, right? And that's what a steak is, right? It's proteins. If you denature those proteins, you develop what's called heterocyclic amines. Big word that says bad protein, right? So you ingest those, and that's why if you like your steaks well done, stop, right? It's better that you don't do that. But there's hope, right? And the best way that you should cook your steaks is always marinate them, because if you marinate those steaks, what you're doing is you're protecting, for lack of a better term, you're protecting those proteins so they actually don't change, at least significantly. So you can protect the majority of those proteins from actually turning into heterocyclic amines actually by marinating your steaks. And you only do it for 2 or 5 minutes.
All right, so if I understand this correctly, you're really recommending that people don't eat red meat, but if they do eat red meat, they should eat red meat that is very lean, the leanest cut they could get,
Yep.
and that it should be grass-fed, not grain-fed or corn-fed. You want grass-fed, so it's natural diet, and if you are going to grill it, don't grill it well done, because that's the worst thing you could do. Instead, what you'd like to do is marinate it up to 3 to 5 minutes. When you grill it, it'll protect the meat. Is that a good summary?
It's a great summary. But now listen, if you're going to marinate for 3 to 5 minutes, you got to get one of those, what do they call them? Those little suction things where you suck air out of them, whatever that's called. What are those called? Anyway, you're smart like that.
Like a turkey baster?
No, no. It's one of those things that's like a pressure, and you suck the pressure out, and it pulls all the thing in. I don't know, man. It's like, my job is just to cook the stuff. So, and that basically pulls that marinade actually into that steak, so you're actually getting it in the nooks and crannies. So that's
is it like a syringe?
Well, it's like a syringe, but it's under pressure. I'll come up with a name. I'll figure it out in a second. My wife's running around here like chasing after the kids. We'll figure it out. So, but anyway, or, you just marinate it like you would like anything. If you marinate it for, in the refrigerator for, a couple hours, give or take, it has the time to actually marinate it in the steak. So that's what you want to do. Steaks aren't bad. There's better steaks than other steaks. You definitely want to, exactly what you said, you want to try to go lean if you can. And again, if you're going, grass-fed, that's going to be even better. And again, marinate those things. All right, so now, let's go over. And you don't like steak. You're like, I don't believe in, eating meat, but I like salmon, right? And that's a great thing. So fish is actually a great thing for you because it's a great source of protein. But the problem is that there's better fish, right? So we got to be careful with, some of the fish that actually has, again, can be, more inflammatory. There's a question, I'm not saying this is exact, there's a question of tilapia and catfish or whether those are the best fish to eat. Personally, I would stay away from those. Salmon, everybody talks about how great salmon is. Now, salmon, a very, very interesting story on here. So I don't know if we talked about this before, but, I was reading multiple articles, several years ago about salmon because I would go out and, I wasn't eating as much red meat. Occasionally I'd do it. I don't, when I go out, I just want to make sure I'm eating the right stuff. And salmon, interestingly enough, there's a difference. And when you go to like Costco or something, you'll see wild salmon, okay, and then you see regular salmon. They don't say farm-raised salmon, but they say wild versus the regular salmon. And the wild was a lot more expensive. This was many years ago, and I was looking it up, and I was like, what a racket, man! Like, wild salmon, they charge much more money. So why is that? Well, actually, what happens is if you look at wild salmon, it actually has a much better ratio of omega-3s to omega-6s. So we're going to kind of go down a little kind of technical lane here. We have specific fatty acids that we can actually get, and those fatty acids, we get them on our diet. We have omega-6, omega-9, there's a bunch of them. We're going to talk about omega-6s and omega-3s. Omega-6s are basically, they are, they're the kind of the fatty acids that actually help kind of break down things. So they actually can kind of, you don't want too much of them because they can actually kind of hurt you. And the omega-3s actually will help kind of build up. You don't want to build up too much. You don't want to break down too much. But the problem is that omega-6s are what we call, they're very pro-inflammatory. So you want some of those, but you don't want too many of those. If you take a salmon, if you take the wild salmon has much more omega-3s than it does omega-6s, right? That's a good thing. So that's what you're paying for when you go out. So when you go out to eat, the first thing you want to ask is this wild salmon? And if it's wild salmon, you don't get that inflammatory properties that you actually get with regular salmon. I have friends of mine now that don't even eat salmon, unless it's wild salmon. They don't touch the stuff because those omega-6s and the inflammatory processes are too high.
Now, Doc BT, this is our rule of thumb that we use in our home. If it says salmon on the menu, and it doesn't say wild salmon, you know that it's not wild salmon.
That's
so
exactly right. Yep.
So make sure if you're going to order it, it has to say wild salmon. The reason it's going to say wild salmon is the chef is already going to know it costs him double to get it or whatever the price is. And so he's going to make sure that's on the menu because people who are looking for it will see that it's a higher quality of salmon.
Yep.
So keep that in mind when you are looking. What else do we got on your do's and don'ts? I know we're getting close to...
Well, we keep going here. We'll just keep going. So we talked about the salmon stuff. We talked about the meat. Tomatoes, lycopene. So if anybody's taking a pill, they'll say, okay, well, I take a lycopene pill. And I'll tell them, sounds like a good idea. But interesting enough, lycopene, okay, is actually located in tomatoes. But what we found with lycopene is that, yeah, sure, you can put it in a pill. And that's why everybody heard this several years ago. Actually, I remember when I was training in the late 90s, early 2000s, that lycopene was the be all and end all supplement to have. And actually, what we found is that it's actually present in tomatoes, but it's actually has to get activated. It's better activated. Your body absorbs it better if it's warmed up. And so a lot of people will talk about using either tomato sauce or actually having like tomatoes and you heat them up and put a little bit of olive oil on it because that actually helps the absorption, and that's a better way to do it. So if you're going to get lycopene, I don't recommend the pills. I think that may or may not help, but I think the right way to do it is eat a couple tomatoes, put some olive oil on it, heat it up. You can put it in the microwave. I'm not like, a caveman that you just builds fires and stuff. There's not a real problem with that. The microwaves are not so evil. And it kind of gets it going. So that's a great thing to do, and lycopene actually will help you out. There's some good data for that, right? Let's go down the veggie pathway, right? So now we have veggies, right? So veggies have this stuff called sulforaphane in it. And sulforaphane actually is a metabolite that's actually in broccoli and in cauliflower. And it's actually, if there's any really good studies out there, broccoli is the best thing to have. Now, we're saying basically you can steam the broccoli, but I'll tell you, I think raw broccoli is probably the best way to go. And, that's probably one of the few things that the raw diet guys really got right is the fact that raw broccoli actually does really help. And so we know that. There's been several good studies on there. But you don't want to fry those veggies. So, people say, I've had patients of mine go, well, I love fried green tomatoes. And I say to them, well, you're kind of like, it's you sort of like defeated the purpose. I mean, here you are actually, eating the tomatoes and you're heating them up, and then you're frying them, and then you're putting those trans fats in there. And we actually know, and actually, there's actually a great study at Anderson, my alma mater, where they looked at the patients who actually had a high, fatty acid, trans fatty acids, and they actually had an increased risk of having a PSA recurrence, after their prostatectomy. So
wow.
I am a big believer in cleaning up these guys' diets. And if any of my patients are out there, they know the first thing I'm going to do is I'm going to sit down with you and say, okay, let's get you cleaned up, because we want to make sure, number one, is that you're living into your 80s, and we're not going to do that unless you're eating healthy. And number two is we want to minimize the chance of cancer coming back, and we actually know that if we can get you eating healthy, that will help out. So veggie, broccoli, cauliflower.
It's interesting for me. I mean, we keep a super clean diet here because my wife and I both have a bunch of food allergies, and I really don't miss it.
Yeah.
I don't, and I actually really like the natural flavors of the food because I'm not on the complete other end of the spectrum where I'm dumping a lot of sauce and a lot of seasoning on top of it, and your body gets acclimated to it. So I think if I had a hamburger now, my body would freak out on me. It'd probably revolt.
They really probably would. It's funny if you talk to vegetarians and then the first time they eat meat, I had a buddy of mine who was a vegetarian. He's not a vegetarian anymore. But, I was actually with him when he said, yeah, I'll have a bite, your steak. And it was actually bison. And this was several years ago. And he was like, yeah, that tastes pretty good. And he actually felt nauseated for the rest of the night. He's like, man, this just sucks. And that was just one bite of a steak. And it was, hey, it was the good stuff, right? Not the bad stuff. So, that's the problem is your body gets used to those things. If you're going down a pathway, it's just as you're doing, and just stay on it. It makes a lot of sense. But again, that's why is because we're not just making this stuff up because my mother told me. It's the fact that there is data out there to actually help us to minimize the chance of recurrence of prostate cancer.
All right, so $64,000 question with no payout. I just want you to know.
Yeah, right. Of course.
The backing, if is prostate cancer something that the right type of lifestyle, diet, exercise could help prevent?
Yes. And so I will tell you that, again, that's sort of a yes in maybe a question mark, behind it. But, the answer is that we know that again, we'll take people, everybody knows this. If you take people, guys from rural China, risk of prostate cancer, less than 3%, we bring them over to the United States, it bumps up to, upwards about, 15, 18%. So what we know is that, it's not the fact that, this is cleaner and we don't live near, like railway stations or something like that, that you do in China. It's the fact of, our diet just sucks. I mean, you drive down, and, you're lucky if you can find Whole Foods. I mean, you got, like, In-N-Out Burger, and then you got, like Sloppy Joe's house, and, you got all these places. And it's so easy to get. That's why it's fast food, because it's fast and easy. So the answer is yes, but you got to keep doing it. So you can't just eat well, like for one night, you're like, all right, I'm good, man, let's go have pizza and beer for the rest of the week. You got to do it consistently because your body has to get used to that. One other thing I want to mention, I want to keep going on this because I think this is important. We wrote a blog on milk. And milk, does not do a body good. And it's actually not as much of the milk, it's actually the high calcium load. So we just have to be very careful with milk. I get all my patients. I was a big milk drinker as a kid. Nowhere near a big milk drinker now. I do not think it's a great idea. Again, primarily just because of the dairy issues, which is something that was, I think, really unexpected. We didn't think it was going to be calcium. We just thought, that, oh, geez, maybe the fat and stuff like that. Even low-fat milk, non-fat milk actually may be even worse, okay, than actually whole milk. But at the end of the days, I would try to just tread lightly, at least on the milk avenue. Milk and cereal, they're both terrible for you, so I kind of keep going with that. One thing that I do want to mention, again, is green tea. And we can probably end on this because I know I'll keep chatting a bunch. Green tea is great for you. So people say to me, okay, well, hey, doc, I started drinking green tea, so I'm good to go, man. I don't need to see you. I'll see you when I'm 85, and maybe I'm in urinary retention, but I'm never going to get prostate cancer. And my next question for them is, how much green tea do you drink? I go, I don't know, maybe a cup or two a day, and I'll tell them, I will see you next year. And the reason why is because that study that they did in Japan, you had to drink at least, I stress this, at least 5 cups of green tea a day. It's got EGCG in it, which is a very, very powerful antioxidant. And green tea, that's one of the few examples that too much of a good thing is not a bad thing. So you got to make sure that if you're drinking green tea, it's doing it sort of all day long. And again, you guys got to keep at it.
All right, so I'm gonna throw it back to you. I drink green tea in the morning. We have a spin bike in our backyard, and as the sun's coming up, I like
your backyard.
Yeah. Well, it's Arizona.
It's Arizona, so it never rains.
It's Arizona, so it's dry. Right. And so I'll go out there in the morning, and I'll get my reading in, and I'll drink a liter of green tea. But it's just one green tea bag, but there's 5 cups in there of water. But that doesn't sound like what you're saying. Are you saying 5 green tea bags a day?
I'm saying 5, quote, glasses of green tea a day. And technically, the study was actually done on green tea, on hot green tea. So it wasn't done, like, of going out to, like, 7-Eleven and getting, like, whatever it is, like, I don't know what the green tea, Arizona iced tea, the green tea stuff, and you're like, I'm good. I would stay away from that stuff. But yeah, you can get these cheap bags. Here's what I do. I get these cheap bags that I get at Costco. I put them in. I put a bunch of them. I put like about 5 or 6 of these bags inside a water, and you can heat it up and you let it sit in there and sit over the refrigerator overnight, and it actually pulls it out. Hot water is the best thing to do because it'll actually pull out a lot of those the important properties of actually that green tea, and then you cool it, and then if you drink that. So now you got 5 bags in this thing, right? And you got a big, 2 liter. If you drink that throughout the day, you're in great shape.
And you're never going to sleep. And then, right, so you're in great shape.
Listen, who needs sleep, right?
Yeah.
So, right.
The other thing that I heard about green tea that's very interesting, Dr. Andrew Weil from the University of Arizona Center for Integrative Medicine has really been a pioneer in, the integrative approach. Yeah. And at either when I was interviewing him, which I've done a few times, or at one of his conferences, I heard him mention that the antioxidants in the green tea, when you add ice, it diminishes the value of the green tea's effectiveness, because all those antioxidants go around the ice cubes. So you drink it and you totally miss it. So his advice was, don't drink green tea with ice cubes. You see people like go to Starbucks and get an ice green tea, right, and that doesn't have the same value.
That's a great point. That I did not know. Yeah, I'm going to look into that. I think that's a great point because I think, most of the time, again, if you can cool it down, and again, that's how I do it. If I make it, it's usually already cold and I throw it in there. But hey, that's a great tip, and I will stop putting ice in any of my green tea. Or if I am, I'll start chewing the ice and maybe I'll start developing pica and maybe get lead poisoning or something. So.
Well, he's Dr. Rich Bevan-Thomas out of USMD in Arlington, Texas. He's our medical director here at Prostate Cancer Live. And I haven't told RBT this yet, but we do have a date for our live event that we're going to be doing with Major League Baseball, and the Arizona Diamondbacks CEO, who is a prostate cancer survivor. We're going to be announcing that in just a couple of days. Perfect. And Doc RBT is going to be there to do the interview at the ballpark. So all that information coming soon. Thank you all for being a part of what is truly a remarkable project to be a part of, and I think we're all honored to not only get to share this great information, but to also have you in our audience, and we hope that you benefit from it. So on behalf of the team at Prostate Cancer Live, myself and Dr. Rich Bevan-Thomas, we wish you all a very healthy and happy week, and we'll look forward to talking with you real soon.
Okay, guys. Thank you.